The title of this lecture is the portal vein. Learning outcomes for the portal vein include, by the end of this lecture, students should be able to, number one, to outline the origin, course, relations, termination, and the tributaries of the portal vein. This is the anatomy of the portal vein. How and where it starts, this is the origin, its course and relations to adjacent structures, its termination at the portohepates of the liver, and the tributaries of the portal vein. So number one is the anatomy of the portal vein. Number two, to locate the sites of portosystemic anastomosis, anastomosis between the tributaries of the portal vein and the veins belonging to systemic circulation. This is called portosystemic anastomosis, and their contributing veins. Which veins belong to portal circulation and which veins belong to systemic circulation at each site of the portosystemic anastomosis. Number three, to clarify the clinical importance of the portosystemic anastomosis in case of portal hypertension. There are signs for the portal hypertension, including the esophageal varices at the lower end of the esophagus, caput medosi around the umbilicus, and the hemorrhoids in the anal canal. Here's a portal vein, also called the hepatic portal vein. Again, this is the portal vein. So, what is the portal venous system? Portal venous system is the venous system formed by the veins draining the abdominal part of the esophagus, stomach, small and large intestine, till the upper half of anal canal, as the lower half of the anal canal drains into the systemic circulation. The upper half of anal canal drains into portal venous system. Portal venous system also includes the veins which drain the spleen, pancreas, and the gallbladder. These veins collect into the portal vein, also called the hepatic portal vein, which breaks into the sinusoids of the liver. So the portal vein begins as a vein by tributaries and ends like an artery by dividing into two branches which enter the corresponding functional lobes of the liver to break into the sinusoids of the liver. Portal vein begins as a vein, ends like an artery. Origin of the portal vein. The origin includes where and how. Where it starts and how it starts. The portal vein is formed behind the neck of the pancreas at the level of second lumbar vertebra. So this is where. It starts behind the neck of the pancreas at the level of second lumbar vertebra. How it starts? By the union of superior-mesenteric and splenic veins. These veins are the formative tributaries of the portal vein, superior-mesenteric and splenic veins. The origin of the portal vein lies anterior to the inferior vena cava. Length of the portal vein. The portal vein is about 8 cm in length and 12 mm in diameter. This is very important. In case of portal hypertension, the case could be diagnosed by measuring the diameter of the portal vein in abdominal sonography. If the diameter is more than 12 mm, it is a sign of portal hypertension. So the normal measures of the portal vein are 8 cm in length and 12 mm in diameter. An important fact about the portal vein and its tributaries is that the portal vein has no valves. This is very important in case of portal hypertension. The portal vein has no valves, so the blood could pass in either directions in portal vein. Course and relations. Portal vein ascends in front of the inferior vena cava. So the inferior vena cava is always posterior to the portal vein. The portal vein passes or runs in 4 anatomical regions. The portal vein ascends in front of the inferior vena cava, behind the neck of the pancreas. This is the first anatomical region. Then first part of the duodenum, second anatomical region. Then it ascends in the right free margin of the lesser omentum, Right free margin of lesser omentum is third anatomical region and it terminates at porta hepatis of the liver. This is the fourth anatomical region. Its relations are described in the following four anatomical sites. At its beginning, it is posterior to the neck of the pancreas and anterior to the inferior vena cava. Always remember that the inferior vena cava is always posterior to the portal vein. So at its beginning, at its origin, it lies posterior to the neck of the pancreas, anterior to the inferior vena cava. Behind the first part of the duodenum, the portal vein lies posterior to the bile duct, anterior to the right, and the gastroduodenal artery anterior to the left, and all these structures are anterior to the inferior vena cava. So the portal vein is posterior to two structures, bile duct and the gastroduodenal artery. All these three structures are behind the first part of the duodenum, and the portal vein lies anterior to the inferior vena cava. In the right free border of the lesser omentum, the portal vein is posterior to the bile duct anterior to the right and hepatic artery anterior to the left. And all these structures within the right free border of the lesser omentum lie anterior to the epiploic foramen into the lesser sac, which separates the portal vein from the inferior vena cava. So in this region, the portal vein is also anterior to the inferior vena cava, but separated from it by the epiploic foramen into the lesser sac. Number 4, at the porta hepatis, at the termination within the liver, the branches of the portal vein are most posterior in the porta hepatis, the hepatic ducts are most anterior, and the branches of the hepatic artery are intermediate in position. This is bad arrangement from posterior to anterior. Branches of the portal vein posterior, branches of hepatic artery intermediate, and hepatic ducts are anterior. Here's the termination of the portal vein by dividing into two branches at the porta hepatis. At the porta hepatis, the portal vein divides into right and left branches. As you remember that the portal vein begins as a vein and ends like an artery by dividing into branches. Each of the right and left branches enters the corresponding functional loop of the liver, the right functional loop of the liver or the left functional loop of the liver. Here is the portal vein where it terminates at the porta hepatis. The right branch of the portal vein receives cystic vein from the gallbladder before it enters into the right functional loop of the liver, while the left branch of the portal vein receives para-umbilical veins which run with the ligamentum teres through the falciform ligament of the peritoneum and connect the portal vein with the veins of the anterior abdominal wall before it enters the left functional loop of the liver. So the right branch receives the cystic vein, while the left branch receives the para-umbilical veins. Also, the left branch is joined by the ligamentum teres from the umbilicus. Ligamentum teres is an embryological remnant. It is the obliterated left umbilical vein in embryology, and is connected to the inferior vena cava by ligamentum venosum. Also, ligamentum venosum is an embryological remnant of a duct called ductus venosus in the fetal circulation. So the left branch is also joined by two ligaments, ligamentum teres from the umbilicus and ligamentum venosum, connecting its left branch to the inferior vena cava. What are the tributaries of the portal vein? Tributaries of the portal vein are 6 tributaries. 2 at its beginning, 2 while it is in the right free margin of the lesser omentum, and 2 tributaries into the branches of the portal vein, which we studied in the previous slide. Cystic vein in the right branch and the para-umbilical veins in the left branch. So at the beginning of the portal vein is formed by the union of 2 tributaries, superior mesenteric and splenic. These are called formative tributaries, the tributaries that form the portal vein, superior mesenteric and splenic. Splenic vein begins at the hilum of the spleen by the union of 5-6 splenic tributaries then pass through the lieno-renal ligament. This is very important. The splenic vein runs in the lieno ligament with the splenic artery and the tail of the pancreas. Then it passes to the right across the posterior abdominal wall behind the body of the pancreas till it reaches behind the neck of the pancreas. The splenic vein unites with superior mesenteric vein to form the portal vein. What are the tributaries of the splenic vein? The splenic vein receives tributaries similar to the branches of the splenic artery. It receives the short gastric veins and the left gastroepiploic vein from the stomach, and receives the pancreatic veins from the pancreas, and receives splenic veins from the spleen, 5 to 6 splenic tributaries. And the last tributary is the inferior mesenteric vein. So again, tributaries of the splenic vein include short gastric, left gastroepiploic, pancreatic, and inferior mesenteric vein. Here, the splenic vein, it runs to the right behind the body of the pancreas to join superior mesenteric vein to form the portal vein. It receives inferior mesenteric vein, one of its tributaries. So, the inferior mesenteric vein, it is the vein of the hind gut. It is an upward continuation of superior rectal vein on the left side of the inferior mesenteric artery. It ascends on the posterior abdominal wall to the left side of the inferior mesenteric artery. It ends in splenic vein. Usually it ends in splenic vein. Sometimes it makes more sharp bend to end in superior mesenteric vein or the junction between superior mesenteric and the splenic veins. It drains the hind gut, drains the rectum, sigmoid colon, descending colons. It drains the hind gut. Tributaries of the inferior mesenteric vein include sigmoid from the sigmoid colon and the left colic from the descending colon. What about the rectum? The rectum is drained by superior rectal vein, which continues as the inferior mesenteric vein. So, the second formative tributary is the superior mesenteric vein. Superior mesenteric vein is the vein of the mid-gut, small intestine and large intestine, till the transverse colon, the left transverse colon. It begins in the right iliac fossa by the union of tributaries from terminal ileum, cecum, and vermiform appendix. It ascends in the root of the mesentery on the right side of superior mesenteric artery to end behind the neck of the pancreas by union with splenic vein to form the portal vein. So superior mesenteric vein is on the right side of its artery, while the inferior mesenteric vein is on the left side of its artery. Superior mesenteric vein is the vein of the midgut. It drains small intestine, cecum, appendix, ascending, and the transverse colons. It drains derivatives of the midgut in embryology. It drains the small intestine, cecum, appendix, ascending, and transverse colons. Here, the superior mesenteric vein ascends on the right side of its artery within the root of the mesentery to end behind the neck of pancreas by union with the splenic vein to form the portal vein. Tributaries of the superior mesenteric vein are the veins which drain derivatives of the midgut. So it receives the jejunal and ileal veins to its convex side from the small intestine, jejunum and ileum. It receives three colic veins: ileocolic, right colic, and the middle colic veins. Ileocolic, right colic, and the middle colic veins from the colon. It receives the right gastroepiploic vein from the stomach, and the pancreatico-duodenal veins from the duodenum and pancreas. These are the tributaries of superior mesenteric vein: jejunal and ileal veins, ileocolic, right colic, middle colic veins from the colon, right gastroepiploic vein from the stomach, pancreatico-duodenal veins from the duodenum and pancreas. Let us continue the tributaries of the portal vein. Two formative tributaries, splenic and superior mesenteric. Then, in the right border of the lesser omentum, it receives the two gastric veins, right and left. The right gastric vein is connected to the right gastroepiploic vein by the pre-pyloric vein, vein of Mayo, pre-pyloric vein. What is the importance of this pre-pyloric vein? This vein lies in front of the pyloric sphincter. It is a marker for surgical identification of the site of the pyloric sphincter during operation. So the right gastric vein is connected to the right gastroepiploic vein by the pre-pyloric vein of Mayo. At the porta hepatis, the last two tributaries, as we mentioned, cystic vein in the right branch of the portal vein and the para-umbilical veins in the left branch of the portal vein. So the portal vein has 6 tributaries in 3 sites, 2 at its beginning, 2 in the right free border of the lesser omentum, and 2 in its branches at the porta hepatis. Clinical note: the blood flow in the portal vein and the malignant diseases. Due to wide angle of union of the splenic vein and superior mesenteric vein, there is wide angle of junction to form the portal vein. This leads to streaming of the blood flow in the portal vein. There are 2 streams of the blood within the portal vein. The right lobe of the liver receives blood mainly from the intestine, whereas the left lobe plus the quadrate and the caudate. Left lobe, left anatomical lobe plus caudate and the quadrate is the left functional lobe. Receives the blood from stomach and spleen. So the right functional lobe of the liver receives blood from the intestine, coming from the superior mesenteric vein, and the left function of the liver receives the blood coming from the stomach and spleen through the splenic vein. What is the importance of this information? This streaming of the blood may explain the distribution of secondary malignant deposits in the liver. So if the primary tumor is present in the intestine, the deposits will lie in the right functional lobe of the liver. While if the primary tumor is in the stomach or the spleen, the secondary deposits will be distributed in the left functional lobe of the liver. This is due to the blood streaming in the portal vein due to the wide angle of union between splenic and superior mesenteric veins. A question: which one of the following veins is a formative tributary of the portal vein? The portal vein has 2 formative tributaries. Yes, splenic and superior mesenteric. So the answer will be number E, splenic vein. Also, superior mesenteric vein is correct if it is present in the distractors. Name 2 tributaries of the branches of the portal vein. Branches of the portal vein receives the 2 tributaries: cystic vein in the right branch and the para-umbilical veins in the left branch. What about portosystemic anastomosis? Definition: veins of the portal venous system anastomose with veins of systemic circulation. These are sites carrying anastomosis between veins belonging to the portal circulation with veins belonging to the systemic circulation. These sites carry a great surgical importance in cases of increased pressure in the portal vein and its tributaries. This case is called portal hypertension. Taking into consideration that the portal vein and its tributaries are valveless, portal vein has no valves, so the blood could pass in either direction. In such cases, the anastomotic veins in these sites become enlarged, tortuous, and engorged with blood. So the veins here at the sites of anastomosis are weak veins, become enlarged and filled with blood, engorged with blood, and tortuous, has a sinuous course. Increased pressure within the portal vein may occur for a wide range of reasons. The portal vein may be compressed by tumors or enlarged lymph nodes. So the reasons of portal hypertension may be tumor pressing the portal vein, or enlarged lymph node pressing the portal vein, or in cases of liver cirrhosis, the fibrosis within the liver compresses the radicals of the portal vein. So the radicals of portal vein are compressed within the liver by the existing fibrous tissue, leading to portal hypertension. In portal hypertension, the anastomosis between portal and systemic circulation may offer an effective collateral circulation. It is an alternative busway for the blood. But these veins are weak, become enlarged, engorged with blood, and tortuous. Here is the sites of portosystemic anastomosis, 3 major sites in addition to 3 other sites. Number 1, the site is the lower end of the esophagus, submucosa of the lower end of the esophagus. The vein belonging to the portal circulation is left gastric vein, while the vein belonging to stomach circulation is azygous and hemiazygous veins. So there is anastomosis between tributaries of the left gastric vein portal and tributaries of azygous and hemiazygous veins systemic. If these veins become enlarged, it forms esophageal varices, varicose veins of esophagus. And if these veins ruptures, it will lead to hematemesis, vomiting of the blood. So the presenting site or the clinical presentation is esophageal varices with hematemesis, vomiting of the blood. Second major site is in anal canal submucosa. Tributaries of superior rectal vein portal, anastomosis with tributaries of middle and the inferior rectal veins of internal iliac systemic. What is the clinical presentation in the anal canal? Hemorrhoids or biles. Hemorrhoids or biles with bleeding per rectum. If these piles rupture, it will lead to bleeding per rectum. Third major site is around the umbilicus, between the para-umbilical veins portal, which terminate into the left branch of the portal vein, and superficial epigastric vein systemic, veins of the anterior abdominal wall. If the anastomosis in these sites becomes engorged with blood, it will form caput medosi. Caput medosi is the head of Medusa, the Greek god, historical god, Medusa. Varicose veins radiating from the umbilicus like snakes around the umbilicus. So it is called the caput medosi, varicose veins radiating from the umbilicus. Other 3 minor sites include at the bed area of the liver, between the veins inside the liver portal and the veins of the diaphragm systemic. Second minor site at the posterior abdominal wall, behind the ascending and descending colons, between the veins of the colon portal and the veins of the posterior abdominal wall. Third, within the liver, if the ductus venosus of the embryology remains patent, it forms direct communication between left branch of the portal vein, this is portal, and the inferior vena cava, this is systemic. So the sixth site is the ductus venosus of the liver, embryological remnant, if it remains patent. Here again the sites of the portosystemic anastomosis, 3 major sites: lower end of the esophagus, around the umbilicus, number 2, number 3 in the anal canal, and 3 minor sites at the bed area of the liver, number 4, behind the ascending and descending colons, number 5, and within the liver, if the ductus venosus remains patent, number 6. Quiz. Outline the sites of portosystemic anastomosis. Again, 3 major sites: lower end of the esophagus, around the umbilicus, and in the anal canal. And the other 3 sites at the bed area of the liver, at the posterior abdominal wall, behind the ascending and descending colons, and in the liver if the ductus venosus remains patent. Which one of the following veins is a tributary of the portal vein sharing in portosystemic anastomosis resulting in caput medosi? To answer these questions, we should locate site of caput medosi around the umbilicus. In portosystemic anastomosis around the umbilicus, which vein belongs to the portal circulation? Correct, para-umbilical veins. And to systemic circulation is superficial epigastric. So the answer for these questions is para-umbilical veins, number B. Dear students, my best wishes and thank you, Professor Hany Waheeb.